President Biden asked his top national security aides to discuss insurgency that threatens to engulf the Middle East and, most urgently, Jan. joined a call to secure one. Find ways to intensify pressure on Houthi militants in Yemen whose attacks on commercial ships the Red Sea are endangering global trade. No one on teleconference, which included National Security Advisor Jake Sullivan, Secretary of State Antony Blinken and other top aides, noticed anything unusual about Defense Secretary Lloyd Austin, the intensely private retired Army general known for his low-drama style and loyalty to President. Like other officials working remotely during the holiday period, Austin was calling from his home in Northern Virginia. White House officials expected to see him at a military promotion ceremony later that week. A few hours later, Austin was instead racing in an ambulance through the Washington suburbs, followed by his security detail. Suffering from nausea and intense pain in his midsection, the 70-year-old was admitted to Walter Reed National Military Medical Center in Maryland, where doctors immediately began treatment for complications from a previous surgery. From his hospital bed that night, Austin juggled his responsibilities as Defense Secretary to maintain America's nuclear arsenal and oversee the 1.3 million military personnel deployed around the world. But Lonely Scene was a far cry from the large entourage that typically surrounds Pentagon chief in his global movements, including policy and communications staff who provide secondary operational updates and enable him to keep aligned to government nerve centers. Even Austin's most senior aides at Pentagon, top officials at the White House or Biden himself had no idea where he was or threats to his health. 1. Who can step into Austin if necessary? 2. Kathleen Hicks was vacationing in the Caribbean. 4 days passed before Austin's medical crisis was made public. The uproar unleashed by news that Pentagon chief had been admitted to 2 hospitals and underwent surgery following a prostate cancer diagnosis without notifying the White House or Pentagon staff, has threatened to overshadow his tenure leading America's expanding military enterprise and a potentially damaging spotlight for Biden as he intensifies his re-election campaign created. Distributor. It has also triggered a debate about the appropriate balance between confidentiality and disclosure for senior government officials and what rights, if any, they have to keep serious medical problems to themselves. Current and former colleagues said Austin's innate introversion and instincts were honed over the decades, but the Army's quiet handling of personal adversity led him astray. It's in his DNA be stoic and noble. In this case, perhaps to a fault, this account of the events surrounding Austin's hospitalization is based on interviews with more than 10 White House and Pentagon officials and a close review of the recording made public by many